All right, let's dive in. Today, we're getting into the nitty-gritty of Integumentary Coding Guidelines.
That's right. It's all about making sure things are billed accurately for any procedure that involves skin.
Now, I know you might be thinking medical coding. That sounds kind of dry.
Yeah.
But trust me, this stuff is fascinating. We're talking about making sure healthcare providers get paid fairly.
Absolutely. And on the flip side, we're also protecting patients from being overcharged.
It's a delicate balance.
It is.
And it really is a bit like detective work, deciphering these codes. We're going to be looking at everything from simple stitches
Right.
to complex skin grafts and everything in between.
And you'd be amazed how detailed these codes get. It's all about specificity.
Okay, so let's lay the groundwork. We've got a ton of source material to cover, but we're going to focus on what happens after those initial skin repairs.
Okay.
The more complex stuff. So picture this. You've got a wound, and a simple stitch-up just isn't going to cut it.
Exactly. That's where we get into things like adjacent tissue transfer.
Okay.
Essentially, you're taking skin from an area near the wound and using it to cover things up. These procedures are coded from 14,000 to 14302. And a really interesting concept here is bundling.
Bundling. What's that?
So let's say, for example, you have a procedure that requires an excision.
You mean removing damaged tissue before you do the transfer?
Precisely. In many cases, that excision is included within the main code. It's all part of the package. You won't see a separate charge for each step, which can be a real lifesaver for patients.
That makes a lot of sense. No hidden costs.
Exactly. Transparency is key.
Okay, but what if there are additional steps, like undermining to loosen up the surrounding skin?
Great question. Undermining is considered more complex.
Ah, I see.
So it's coded separately. And if you need a skin graft on top of the transfer, that's a separate code too. It's very granular.
Wow. Okay. Can you give us an example, like a real-world procedure?
Sure. Let's say a Z-plasty, for example. That falls under code 15040. It's a specific type of adjacent tissue transfer, often used for scar revisions or to relieve tension around a wound. The surgeon meticulously rearranges those skin flaps.
To create a Z shape, right?
Exactly.
So even within this broader category of adjacent tissue transfer, there are specific codes for each technique.
Absolutely. It's capturing that precise work. And it gets even more detailed when we move into skin replacement.
Which is often necessary for larger wounds or deeper wounds.
Exactly. Now, there are codes for both the surgical preparation, that's codes 15,002 to 507,005. And then for the grafts themselves.
Okay, so the surgical preparation is like, what? Getting the wound ready.
It's like prepping a canvas before you paint. You need to clean the area, prepare the wound bed. The codes vary depending on the size and location.
Setting the stage for healing. But let's talk about the grafts themselves.
Yeah.
No, there are different types, right?
You got it. We've got autografts, which use the patient's own skin. Those are coded from 15040 to 15261. And then we have skin substitute grafts, coded 15271 to 15278, which use materials from other sources.
Other sources? Like what are we talking about here?
Well, it could be from a donor, an allograft, or, believe it or not, even animal sources.
Wow. Animal sources.
It's called a xenograft. These are used when a patient doesn't have enough healthy skin for an autograft.
That's amazing. It sounds like science fiction, but it's real.
It is, and it's pretty incredible. Yeah. But to answer your question about coding, it all comes down to the details. The codes for skin substitute grafts, just like autografts, depend on the type, the thickness, and the location. And it's important to note that if the surgeon needs to perform debridement, removing dead or damaged tissue, before applying the graft, that's usually bundled into the main graft code.
So it's not just about slapping on a patch of skin.
No.
There's a lot of prep work involved.
Exactly. And that careful attention to detail is reflected in these codes, ensuring every step is accurately documented and billed.
This is making a lot of sense, but I think it would be helpful to see some real-world examples of how these codes are used.
Okay, sure. So imagine someone comes in with a burn on their fingertip. A second-degree burn, about the size of a dime.
Ouch. Yeah.
Now, for a smaller wound like this, the surgeon might choose to use a pinch graft, which is a very thin autograft, coded 15040.
Okay.
It's a relatively simple procedure, but the coding ensures that the surgeon is appropriately compensated for their expertise.
So even a small burn needs that precise coding.
Absolutely. And it gets even more crucial when multiple procedures are involved. Let's say our patient with the fingertip burn also has a larger, deeper burn on their forearm.
Oh.
That requires a split-thickness skin graft. That will be a separate procedure, and we'd use something called Modifier 59.
Modifier 59, I've heard of that.
It tells the insurance company that the split thickness graft is distinct from the pinch graft.
Even though they both involve skin. So it's like adding a little flag to the code saying, hey, this is separate.
Exactly. It prevents confusion and makes sure the surgeon is paid for both procedures.
Okay, that's a great example. I'm starting to see how important these modifiers are. But before we go any further, I think it's important to step back and talk about the bigger picture.
Sure.
Why are these codes so important?
Well, accurate coding is fundamental to the entire healthcare system. First and foremost, it ensures that procedures are documented and tracked.
Right.
This is essential for research, public health data, and improving quality of care.
So it's not just about the money.
No, it's much bigger than that.
It's about having a clear picture of what's happening.
Exactly. And of course, it's about protecting both the provider and the patient. For providers, accurate coding means they're fairly compensated for their work, which allows them to continue providing that quality care. And for patients, it prevents overcharging and ensures they're only billed for the procedures they received.
A system of checks and balances.
Exactly. And believe it or not, we've only just scratched the surface of Integumentary Coding Guidelines. There's a whole world of complexity out there when we start looking at flaps, burns, and even specialized procedures like Mohs surgery.
I can't wait. But for now, I think it's time to take a quick breather. We'll be back in a moment to delve deeper into these fascinating guidelines.
Welcome back. We're diving deeper into those integumentary coding guidelines.
I'm still trying to wrap my head around all these details, I gotta say.
Yeah.
It's a lot to take in.
It is. There's a lot to it. But remember, accuracy is key.
Right. Especially as those procedures get more complex. And speaking of complex,
yes.
We've talked about grafts, we've talked about transfers.
Right.
What about those times when you need to actually move an entire flap of tissue with its own blood supply?
Yes. That brings us to the world of flaps, covered by codes 15570 to 15778. These are often used for larger wounds, or more complex wounds where a simple graft just isn't enough.
Yeah. It sounds like it takes a lot of skill, surgical artistry almost.
Yeah, it does. It's pretty amazing. Imagine taking a section of skin and tissue, complete with blood vessels, and moving it to cover that wound. Sometimes it involves rotating tissue from a nearby area. Sometimes it's even transferred from a completely different part of the body.
Like a surgical jigsaw puzzle.
Exactly. And just like with the jigsaw puzzle, each piece, or in this case, each step of that flap procedure, needs to be coded accurately. Creating the flap, delaying it to enhance blood supply, transferring it, all of these have specific codes.
So it's not just one code for the whole thing, it's broken down.
It is, into each little step. And then it gets even more detailed when you consider things like immobilization devices and donor sites.
Oh, right, because if they're taking tissue from somewhere else.
You have to code that too. So if they use a special device to hold the flap in place, that gets its own code. And if they had to take tissue from another part of the body, the donor site gets coded as well.
So it's like a chain reaction of codes, each linked to a very specific part.
It is. It's like painting a picture, a complete picture of that surgical journey, ensuring everything is documented and billed appropriately. Remember, it's about protecting both the patient and the provider.
That's amazing. It's a lot to keep track of, honestly. My brain's feeling a bit overloaded.
Well, we have covered a lot.
Can we maybe change gears for a second?
Sure. What do you have in mind?
Well, I've always been curious about how burns are coded. It seems like that would be particularly challenging.
It is, you're right. It's a whole other ballgame.
Yeah.
Yeah. Burns are coded from 16,000 to 16036.
Okay.
And it's not just about the size of the burn, it's about the depth and the percentage of the body that's affected.
So you're not just measuring the burn. You're figuring out how deep it goes and how much of the body is involved.
Exactly. And to estimate the total body surface area affected by burns, physicians often use a specialized tool called the Lundbrauder chart.
The Lundbrauder chart. Never heard of that.
It helps them accurately assess the extent of the injury.
So a small, deep burn might have a different code than a large, superficial burn.
Precisely. And then you have to think about the different types of burns. Thermal burns, chemical burns, electrical burns. Each type can require a different approach to treatment, which is reflected in the coding.
Wow. It sounds incredibly complex. Like you need to be a coding expert to get it right.
It definitely requires specialized knowledge, yeah, and a very keen eye for detail. But all that precision is crucial for ensuring fair reimbursement.
Yeah. because burn care can be really extensive.
It can. Lengthy treatments, rehab, it can be a long road to recovery.
It makes you realize how important those medical coders are.
Absolutely.
They're like the unsung heroes, making sure everything runs smoothly behind the scenes.
That's a great way to put it. They're the ones who translate these complex medical procedures into a language that the insurance companies can understand.
Right. Speaking of translating those complex procedures, can we maybe circle back to some of those codes?
Sure, which ones?
I think it'd be helpful to see some real-world examples.
Okay, yeah. Let's take code 1202, for instance. This one is for an intermediate repair of a 2.5 centimeter laceration on the scalp. Imagine someone comes in after a fall, they've got a cut on their head. If that cut requires layered closure with sutures beneath the skin, that would be 2332.
So the code tells you the type of repair, but also the location and the size.
It does. It's very specific. And let's not forget about our modifiers.
Right. Modifier 59.
Exactly. So if our patient with the scalp laceration also needed a mole removed from their arm,
right. Two separate things.
that would be a distinct procedure, and we'd use modifier 59 to indicate that. It's separate from the scalp repair, so it's billed correctly.
It's all starting to click now.
Good.
The codes and modifiers working together to create a complete picture.
They do. It's a language of precision.
We've covered a lot of ground.
We have.
But there's still so much more to explore.
There is. Mohs surgery, breast biopsies, each with their own unique coding challenges.
And we can't forget about the fact that these guidelines are constantly evolving.
They are. Technology changes, new treatments emerge.
The coding system has to adapt.
It does. It's a dynamic system, and it takes constant work to keep it accurate and fair.
Well, I'm excited to dive into those topics in our final segment. And we're back, still diving deep into those integumentary coding guidelines.
That's right. We've journeyed through grafts and flaps and burns.
We have. But there's more to uncover.
Oh, absolutely. We've got a whole other layer of complexity ahead of us.
I'm ready for the challenge.
Yeah.
You mentioned Mohs surgery before.
Yeah.
And breast biopsies.
Yes. Those are definitely procedures that need a whole different level of expertise when it comes to coding.
I can imagine. Let's start with Mohs surgery.
Okay, sure. Mohs surgery, that's a highly specialized technique for removing skin cancer.
Right.
The codes for that are 1-in-301 to 1-in-315. And it's all about precision. The surgeon actually removes the tumor layer by layer, examining each layer under a microscope until all the cancerous cells are gone.
Wow. So it's like a microscopic treasure hunt, searching for those tiny cancer cells.
Exactly. And the coding reflects that meticulous process. It takes into account the location of the tumor, the stage of the cancer, even the number of slices that are examined.
So the more complex the surgery, the higher the code?
Generally, yes. And something interesting about Mohs surgery, routine pathology is actually excluded from those codes.
Oh, really? Why?
Because the microscopic examination is considered so integral to the procedure, it's bundled into that main code.
That makes sense. It's all part of the same process.
Yeah.
It's not just about cutting out the tumor. It's about that real-time analysis.
Yeah.
Making sure every last cell is gone.
Exactly. And that level of detail in the coding ensures that the surgeon is paid appropriately.
Right. Because it's so time-intensive, and it takes so much expertise.
It does. And speaking of specialized coding, let's talk about breast biopsies.
Okay, yeah, those are covered by codes 1901 to 19126.
Right, and those encompass a wide range of techniques, everything from fine needle aspiration to open surgical biopsy.
So the coding depends on how they get that tissue sample.
Exactly. And just like other procedures, things like guidance type, whether it's ultrasound or stereotactic or something else, and the number of lesions biopsied, that all plays a role in choosing the right code.
It's fascinating how much detail goes into this.
It is. It's about creating that accurate picture of the care provided.
Speaking of accurate pictures, I think we've covered a pretty broad range of integumentary coding guidelines today.
We have. We started with basic skin repairs, and we've gone all the way to complex flaps and specialized procedures.
We've been on quite a journey.
We have. But before we wrap up, it's important to remember that this is just a snapshot. Medical coding is always evolving. As technology advances, new treatments come out. The system has to adapt.
It's a dynamic system.
It is.
New procedures, new codes. It's a lot to keep up with.
It is. And those medical coders, they really have their work cut out for them. They have to stay up to date on all those changes.
They're the ones who keep everything running smoothly.
Absolutely. Their expertise is so valuable.
I've learned so much today. I had no idea how intricate this whole world of coding was.
It's pretty amazing, isn't it? It's like a secret language. The key to understanding how the healthcare system works.
It is. And it's so important. It ensures accurate billing. It protects patients from overcharges. It makes sure those providers are supported. It's a win-win for everyone.
Exactly.
So next time we see a bandage or a scar or any sign of a skin repair, let's take a moment to think about those complex codes.
Yes, and appreciate the work that goes into it.
It's a hidden world, but a crucial one. To all those medical coders out there, we salute you. Thanks for listening, everyone, and keep on exploring, learning, and asking those curious questions.